Dr. Al Glover. I practice podiatry in Los Angeles, California. And my capstone is about inspiring the next generation of climate warriors. What's the problem? As we've heard from Dr. Benjamin and others, there's been years of environmental injustices that have disproportionately impacted communities of color. The effects of climate change on the most vulnerable populations that do the least to cause it. What my project was about is the need for young voices in these communities to inform, educate about environmental issues and the associated health impacts. Next, please. I'm a board member of one of the larger pipeline organizations for young individuals of color that are in either junior college or college. We have members who are in medical school now and residents, and we have over 14,000 members that represent mainly in California, but we're also in Arizona, Washington State, and Georgia. We kind of came together and talked about what we wanted to do, and I was amazed at the excitement that these young people, 17, 18, 19, 20, and older, had. So we decided what we would call ourselves. And they said, together we advocate for environmental justice. We started out with simple things, with them doing TikTok videos and doing stuff on Instagram and blogs about the environmental injustices in their communities. And it was amazing. These kids came up with some innovative things that really blew me away. We also met with a lot of our local legislators, from county councilmen to currently Mayor Karen Bass. She met with them to talk about policy, to talk about planning, to talk about how they can make a difference. And we also had Congresswoman Maxine Waters talk to them, talking about what their impact would be. Of course, I've written a number of op-eds in our local paper, but the other thing is we wanted them to interview with members of the NMA, the California Healthcare Foundation, and other large medical organizations to really get their mentorship. And then finally, what we're doing in our community, we're doing a lot of faith-based communication with young people and with communities of color with nonprofit organizations. Next. This is just a picture of one of our first gatherings of some of the members of our organization. And one of the things that we really wanted to do next steps was to really continue to emphasize policy, to emphasize voting. That has been a big impact for us, because without the vote, and with these young people being the leaders as they go back to their universities, their medical schools, starting organizations, but understanding that all this work that this administration has done will go by the wayside if we don't vote. So that's been very important. The other thing is we talk to them about doing research, because they have to be on the cutting edge to making the change with doing data, research, and continuing on. I plan to continue to work with these young people because they are the future. No matter what I do, but if I can plant 5 seeds and they can plant 5 seeds, then I've done my job. I will continue to do stuff, of course, with our organization, with the Medical Consortium in California, and nationally, and the Speakers Bureau. But I love what these young people are doing, and I think that they are going to be the game changers for us. Thank you.
Everyone, I am Dr. Dee Harrison. I am a practicing podiatrist at Milwaukee Health Services, which is a federally qualified healthcare center. My capstone project involved creating greater access to healthy food. Next slide, please. Climate change affects both the quantity and the quality of food, and that is because climate change contaminates food and contaminates water. As a result, we get food scarcity, which what does that do? It increases food prices, making people more at risk for food insecurity. Consequently, there are greater incidences of diabetes, stroke, hypertension, and heart disease. As a podiatrist, I see the foot health effects worsened diabetic neuropathy, more advanced circulation problems, non-healing wounds, which leads to gangrene and amputations. The most vulnerable populations are the populations I serve, being in a federally qualified healthcare center. Black, Indigenous, people of color, that's what BPOC stands for, people with disabilities, the old, the young, the LGBTQI plus communities, those are the vulnerable populations. Consequently, greater access is needed to help for healthy food for these vulnerable populations. Next slide, please. My key actions over the last 10 months have involved 3 sections: food, education, and community involvement. I am in the process of organizing a program, a food prescription. Just like you go to the doctors and the doctors gives you a prescription for ibuprofen. Well, instead, those vulnerable populations get a prescription for fresh fruits and vegetables. The patients are referred by either their health insurance or they're referred by their health care providers. A food insecurity questionnaire was also instituted at my institution. Also, to help with food insecurity, I've established a farmers market to come to our clinic. And there were lots and lots of meetings that are held and are being held to establish this program. Patients who are at risk for food insecurity are also given a list of institutions around the city to give out, like pantries or whatever, to give out fresh fruits and vegetables at low or no cost. Educationally wise, I've attended a DC Food and Medicine. Also, I am in a food medicine program through the Academy of Lifestyle Medicine. Additionally, I gave 2 lectures at the NMA prior convention in New Orleans. I also was able to be blessed to give lectures at my in front of my providers at my job, as well as the Rotary Club. I also was a facilitator for the 2nd year students at the Milwaukee College of Wisconsin Climate Health Change Program. With regards to the community, I've testified with the EPA. I authored 2 NMA resolutions in the House of Delegates and published an op-ed in the Madison Cap Times. Next slide, please. My next steps involve bringing fresh PICS mobile markets to all of the Wisconsin FQHCs. Additionally, the food prescription program, which I've started at my clinic and a sister clinic, I would like to expand that to statewide so that all of the FQHCs would be eligible to be involved in that program. I'm also identifying funding sources for the food prescription program, and I want to bring a cooking-based nutrition education. I am also slated to be a lecturer for the family medicine residents at our clinic. Additionally, I do plan on participating or continuing my participation, I should say, in the Healthy Climate Wisconsin, as well as the Medical Consortium. I also plan on being a speaker. I want to thank Dr. Mark Mitchell, who is the originator of this wonderful program, all of my advisors. Thank you so much for this opportunity to learn these last 10 months. Thank you for your attention and have a happy holiday. Thank you.